CSR or central serous retinopathy is a condition in which there is fluid accumulation under the retina. Retina, as you know, is the light sensitive layer of the eye, the inner layer of the eye where the light comes and falls. So, under the retina and inside the retina, you can have fluid accumulation due to various causes. Sometimes these causes are inflammatory, sometimes these causes are infective. But without either inflammation or infective, when you have fluid accumulation under the retina, it is this condition called central serous retinopathy. So, central serous retinopathy generally presents as a black area in the center of your vision. It is usually circular in shape, but it can be of various shapes, but it affects your central vision. So, whenever you look at something, there will be a black shadow or a black area that you are not able to see as clearly as you can see the rest of the parts. That is the usual symptom. Sometimes when it is away from the area that is needed for vision, CSR can be asymptomatic also. You may not realize it is there until somebody examines your retina and tells you that there is CSR present. There is generally it is believed to be an idiopathic condition. We don't really know what causes CSR, but the most common association that has come up in studies is an association with stress and type A personalities. That is people who are a bit competitive and who take a lot of tension and stress for simple things. Those people are more likely to develop CSR. The other risk factor is use of steroids. Now, steroids are a very important medicine in modern medicine. They are needed for a lot of conditions, but unfortunately, some people, when they have steroids, this fluid accumulation happens. Sometimes the steroid intake may be not known to you. You may not realize that you are taking steroids. For example, you are using some cream for your eczema or some allergic skin reaction, or you are using some Ayurveda medications. Sometimes they have some mild plant steroids or maybe present in those medications. Then sometimes you may use inhalers, which again will contain some amount of steroids. So, that is the other external factor that can cause CSR. There is also an association with certain small tumors that produce steroid in your body. Like if you have a pituitary tumor that is secreting the steroid, or some other gland tumor that is secreting steroids, and you have a generally higher level of steroid in your body, that also can cause CSR. When the CSR is happening for the first time, you are developing it for the first time, except for a history of steroid use, we don't really do a lot of tests. We do something called an OCT, optical coherence tomography. And OCT gives us a quantitative and qualitative assessment of the retina. So, it tells us whether the fluid is a clear fluid, or is there blood in it, or is there any other factor that tells us that this is not CSR. So, diagnostically, it is very important to do the scan called the OCT. Also, it helps us in monitoring how much response is there. As it is getting better, is it getting better? Is it getting fully better? Or is it remaining at a lower rate? Is there still fluid persisting in the retina? That all these information we will get from the OCT. So, first we will do the OCT, and then maybe a month later your doctor will tell you to repeat the OCT so that we can find out if the fluid is coming down. Since the condition is idiopathic and it is mostly personality related, we really cannot give a full treatment and cure the condition. Generally, it is self-limiting, and in about 1 or 2 months, the fluid will reduce, and the fluid will reduce, and that black area will become better. So, during that time, we give some medications that will help in the fluid resorption, and we also give some eye drops that will give some soothing effect to the eye. We also look for risk factors. For example, if you are a type A personality or you're doing a job that has having a lot of night shifts or you're working with different time zones, we ask you to adjust that so that the body gets a little bit more rest and relaxation, and not only the body, the mind also. So we advise a lot of things like lifestyle modifications. Some people do benefit from a small amount of anxiolytic, which reduces the general anxiety level. But generally, we eye doctors don't prescribe it on our own. If you have severe anxiety or difficulty like that, we ask you to consult either a physician or a psychologist and take help. That is the usual treatment given for the first episode. So, if you let CSR go without being treated, it will probably resolve by itself in the first episode. But because it is related to your personality, there is a likelihood that repeated episodes will come. And repeated episodes, when the fluid comes in various parts of your retina, especially if it keeps on recurring in the area that is needed for vision, and also if you get an episode and it is not resolving completely, you have not done an OCT but you feel that it is better, so you don't take any further action, and then you then go to the doctor only when you get an exacerbation. When that happens, what happens is that the fluid remains in the area needed for vision, what we call the macula or the fovea, for a long time, and that causes damage to your very sensitive cells that we need for vision, called photoreceptors. Once the photoreceptors and the cells under that, called the retinal pigment epithelium, gets damaged, then it is very difficult to reverse the damage. It is practically impossible to reverse the damage. So the condition called chronic CSR or a chronic recurrent CSR will cause semi-permanent loss of vision. So that has to be avoided. Because the condition is idiopathic and related to your personality or your work or your lifestyle, sometimes it is very difficult to prevent recurrence. So you can do some amount of lifestyle modifications. If you are on chronic steroids for some reason, if it is possible to change the steroid, we usually give a request to your treating physician or dermatologist to change the steroid to a non-steroidal drug. Those two things can be done to prevent recurrence. The most important thing that can be done is that as each recurrence comes, you have to check that the recurrence is resolving completely. There is no residual fluid in the retina by getting your eye checked up after every episode. And if the CSR is recurring and if it is remaining for a long time, for example, it should actually go off after 1 month. And if you are not symptomatically better after 1 month, and when we do the OCT, the fluid is remaining like that, then you need to undergo further tests so that we prevent the damage to the retina. So when you are getting recurrent CSR or the CSR is not resolving, your doctor will usually advise you to undergo a fundus fluorescein angiogram. Fluorescein angiogram is a test in which the dye is injected into your vein and photos are taken of your retina. That will tell us exactly where it is leaking, where this fluid is coming from, and if the area is away from the area needed for vision, we are able to do a light laser called a CSR laser and to close that leak. But unfortunately, sometimes the leakage will be too close to the area that is needed for vision, in which case we really cannot treat it with laser. But we do have some other drugs that will allow the fluid to be absorbed faster. Some of the drugs are like eplerenone, which will help the fluid to resolve faster. So the leaks that are not laserable, then we consider medical management, and sometimes in a lot of recurrence and then when there is ongoing damage, we also recommend something called a photodynamic therapy. So all that has to be decided by the treating doctor depending on your fluorescein angiogram result and the OCT result. You can also do a test called the autofluorescence. Now, autofluorescence picks up a normal phenomena in your retina and tells us how much damage your cells are having, especially the retinal pigment epithelial cells. So that also helps us assess the damage and treat you accordingly. So in summary, central serous retinopathy is a relatively simple disease in which there is a small amount of fluid accumulation in your retina and it will go off after some time. What we can do to prevent it from happening is to take less stress and be tension free and do some lifestyle modifications that will help you to reduce the stress. If it is allowed to go on for a long time or it comes back again and again, then it is a dangerous disease. So it needs to be followed up. So if you have CSR, the most important thing is that you see your retina specialist and you do serial OCTs so that we see that the CSR is resolving or not. You do the tests as necessary, as advised you, and get the treatment on time. Because once the photoreceptor damage sets in, then it is very difficult to reverse. And the doctor will be able to assess you for other risk factors for CSR also.